Welcome back to The Full View. Let's update you on COVID-19 in South Africa right now. Infection rates are coming down on a daily basis. According to the latest daily stats, there were 1,227 new cases and 81 recorded new deaths. Now, despite the lull, if we look at this in compared to where we've come from in terms of the peak of the second wave, there are concerns about a third wave. To discuss, we're joined by CSIR Senior Researcher Dr Ridhwaan Suliman. Thank you, Doctor, for being with us and for providing some great graphs. Let's start with the average COVID-19 cases per day, but you look at a weekly average. We'll write down and explain why on this graph we're in the green, as it were.
Good evening, Francis. The graph that you probably put up now indicates the new number of daily cases reported across the country, and the color indicates the test positivity rate. So if you look first at over the last week, we've reported just over 1,100 new cases on average per day over the last week, and that's continued to decline. It's declined 19% compared to a week ago. Now, the rate of decline has slowed slightly compared to what we were seeing a month to 6 weeks ago, but it's certainly moving in the right direction. In fact, the figure at the moment is lower than what we saw between the first and second waves, and it's now at a point as what we saw last in May 2020. So it's certainly on the right trend, and it's looking good. As you can see from the color of the bars, there's a slight change in the last bar, and that's because the test positivity rate is also decreasing, now below 5%, which is good as well, and confirms that the decline that we're seeing in cases is real.
All right, and we'll look closely at testing in a little while. Just very quickly, I mean, should we be cognizant of the fact that this graph could change and change quite quickly like it did last time? There are concerns about a third wave. Is that something that you're thinking about?
Yes, indeed. Of course, the risk of further outbreaks always remains, and we do need to remain vigilant and watch for any resurgence. Given we've now got a year's worth of data, and given what we saw over the past year, it is likely, though not inevitable, that we will see a third wave in a couple months' time or over the winter period. I'd like to be optimistic and think that it's not necessarily inevitable, but given our track record, it is likely that we will see a third wave. It is still within our control the extent and the severity that the next wave will, to what extent we will see that. Of course, it is dependent whether the virus will evolve and mutate further. So the focus needs to be on reducing transmission and reducing the opportunities for the virus to replicate. So we, of course, continue to monitor for any resurgence, and we hope that we can try and manage any outbreaks before we get to an inevitable wave going forward.
All right, Doctor, if we come back to where we are right now, looking relatively good. So we've looked at the overall daily average across a week. Let's zone in on the provinces. And can we say categorically all of the provinces are out of the woods for now, at least?
Indeed, similar to what we saw at a national level, all 9 provinces continue to decline. The incidence rates are continuously going down. If we measure the thresholds by which the incidence rate has declined compared to the peak that each of the provinces saw, 8 of the 9 provinces are below 15% of the peak of their second wave. It's just Northern Cape, which is a bit slow to decline. That being said, all of the provinces are reporting incidence rates at the moment of below 4 new cases per 100,000 people, and that is a good place to be at. The Northern Cape currently sitting at about 4 new cases per 100,000 people, but all of the other provinces are around 2 new cases per 100,000 people per day. In fact, Limpopo and Eastern Cape are below 1 per 100,000 people. So certainly much lower risk, and all the provinces are following what we saw at a national level.
Yeah. Oh, if only we could just cheer this, but there is still that possibility that things could go up again. Let's bring up the next 2 graphs around testing. First, tell us how we're doing if we look at the average daily test. It seems that testing has come down, but not as much as the infection rate itself. Is that a good thing?
Yeah, so it looks like the testing has sort of leveled off or stabilized at between 25 to 30,000 tests per day, and we've seen that over the last month now. The last week, the average number of tests per day is about 26,000. It's decreasing slightly, as you can see, down 3% compared to a week ago. However, I think the testing levels have stabilized. And if we look at the number of tests that are returning positive results, we certainly are testing now at the right levels compared to the number of infections that we are seeing. Maybe a point of interest to note is that over the last month, the number of tests that are, or the breakup between PCR tests versus the antigen tests, over the last month, 20% of the total tests are the antigen-based or rapid testing. So perhaps there's scope to increase that if we want to perhaps increase testing and be more proactive in our monitoring and surveillance using the testing tool.
All right, and we won't look at positivity rate. You've said it's at that good number, below 5% now. Let's skip ahead to hospitals. Is the pressure really off hospitals in terms of admissions right now?
It certainly, the pressure has lowered compared to what we were seeing a few weeks ago. The last week saw the number of new admissions across the country just over 2,300, and that, as we saw in the trend in cases, is continuously declining. It's declined by 21% compared to a week ago, and it should follow the trend in cases and continue to decline. At the moment, the number of new admissions is sort of similar to the level of plateau between the first and second wave. So hopefully that will continue to decline, and the pressure on hospitals and healthcare workers will ease off now.
And very quickly, let's look at the death rate. I mean, families are still losing loved ones. Our condolences. But 81 deaths down, and you've often said that lags. Usually the infection rate comes down, then the death rate comes down.
Yes, that's correct. So we are seeing that the death rate is coming down. Over the last week, we've reported 101 new deaths per day on average. And that is high, of course. But we see that it has decreased by 29% compared to what we were reporting a week ago. And also because, as you say, that this figure does lag cases, we should expect that the death numbers should continue to decline for the next few weeks.
All right, let's move to the kicker now. Dr. Suliman, the focus is on vaccinations. And unfortunately, I mean, I wish we could be blitzing vaccines that would prevent the third wave. Where are we now? Because if we bring up this graph, it looks like we were above 11,000 or so in a day to 1,300 or so. What's to blame for that decline in the rate at which we're giving jabs?
So we need to bear in mind that at the moment we are vaccinating the Johnson & Johnson vaccinations, and that's part of an implementation study or phase 3B research study, and that is being administered to healthcare workers at the moment. So if we look at the number of vaccinations administered per day, as shown by this graph here, in total we've administered just over 101,000 vaccines to healthcare workers. At the most we administered in a day was just over 11,000. But the numbers are limited to the number of doses that we currently have. We received 80,000 doses a couple weeks ago, and those have all been administered. And we're now onto the second batch of 80,000 doses. So I believe that the speed is limited by the number of doses that we have, and we need to bear in mind that this is still part of the implementation study. The speed will no doubt continue to increase with a wider vaccine rollout and as we acquire more doses with a wider national rollout.
All right, we're holding thumbs that that'll be soon. Thank you very much. A great overview of where we are in terms of COVID-19 infections and the vaccination rate as well. That was Dr. Ridhwaan Suliman, a CSIR Senior Researcher. All right, and then just